Ladies and gentlemen, healthcare advocates, and esteemed guests, a warm welcome to the third session of our empowering series against lung cancer. I'm Simran Kaur, your moderator for the evening, representing the voice of healthcare. Before we delve into tonight's crucial discussion, let me express our heartfelt gratitude to Pfizer for their invaluable support in bringing the series to life. In our previous panels, we dug into early diagnosis and treatment options, laying the foundation for tonight's discussion. The focus shifts, but the mission remains the same, addressing challenges and building advocacy for lung cancer in India. Now, let's set the stage for the conversation by introducing the esteemed voices that will guide us through today's session. We are honored to have with us Dr. Bhuvan Chugh, Senior Consultant in Medical Oncology at Max Hospital Gurgaon and Max Super Speciality Hospital Saket. Dr. G. Vamshi Krishna Reddy, Director of Medical Oncology Services at Yashoda Hospitals, Hyderabad. Dr. Suhail Qureshi, Senior Consultant and Unit Head in Medical Oncology at Fortis Hospital, Shalimar, Bagh, Delhi. And Dr. Amit Dutt, Senior Consultant at Apollo Cancer Center, Kolkata. Their expertise and dedication to the field are truly commendable, and we are fortunate to have them guide us through tonight's session. Now, with the stage being set and our esteemed panelists being introduced, let's turn our attention to the heart of the matter. The topic that we are going to discuss is addressing challenges and building advocacy for lung cancer in India. In this session, we aim to explore avenues beyond diagnosis and treatment, seeking ways to empower individuals and communities in the face of this formidable challenge. So let's start with the session, and I welcome you all.
Yeah,
So
thank you.
Dr. Reddy has also joined us. So my first question is to Dr. Reddy. Doctor, welcome. And I'll start with the discussion. I'll start with the first question. So my question to you is, what strategies or initiatives do you think that can boost the screening and early detection of lung cancer in India, considering that there is a diverse healthcare landscape that is there? Dr. Reddy, I'm so sorry, you're on mute. Could you please unmute yourself? I can't hear you, Dr. Reddy. No, you're not audible. We'll move on to Dr. Sohail till Dr. Reddy can, solve this technical glitch. Dr. Sohail, could you give us an overview of the current lung cancer treatment options in India and how they've evolved, considering, in the recent years?
So thank you, Simran, and thank you to Pfizer for organizing this session and taking the initiative for uh, raising awareness for lung cancer, which is soon going to become a global health emergency. And according to the recent Globokine data, which was published in 2020, it is estimated that every year, anywhere between 1.5 to 2 crore lung cancer cases are diagnosed worldwide. And this number is likely to swell up to around 2.8 to 3 crores by the year 2040. With the current rising air pollution around us and Delhi actually experiencing a spate of air pollution leading to closure of schools and workplaces, this becomes all the more important to address these issues and raise awareness. As far as the treatment landscape of lung cancer is concerned, I feel we've come a long way from the traditional model of lung cancer, wherein it was considered to be a death sentence back in the 70s or 80s, to an era of 2020s now, where it has now become more of a chronic ailment like diabetes and blood pressure with the emerging treatment options. So initially, when the treatment was very rudimentary in the 80s, we had the good old chemotherapy and maybe a radiotherapy. And in very few patients in early stages, surgery used to be an option. With the evolving role of molecular targets in the 90s and early 2000s, the lung cancer treatment guidelines evolved to an area wherein oral targeted therapy became an integral part of lung cancer treatment, so much so that just labeling someone as lung cancer was not complete in itself. It was just very incomplete a sentence. So you must have the diagnosis with respect to the type of lung cancer you're talking about, whether it is small cell or non-small cell, the molecular targets that are being talked about, and then uh, very quickly this kind of evolved into an era where newer generation of targeted drugs became available, whether it was anti-EGFR drugs, ALK inhibitors, or for that matter, ROS inhibitors, and now we have drugs in the domain of NTRK fusion inhibitors as well as anti-HER2 drugs, which are now transforming the way we have traditionally looked at lung cancer. Another new and very interesting and I would say revolutionizing development that has taken place is that of immunotherapy that has completely changed the way we used to treat lung cancer 30 years back. So, immunotherapy are drugs which are given in an intravenous form, either through a saline bottle or a glucose drip through the veins into the blood, which uh, stimulates your body's own immunity to fight against the cancer. It generally does not have side effects like chemotherapy, is better tolerated, and there are certain patients in whom we have seen immunotherapy to work for a long, long period of time and yield magical results sometimes. So, to summarize, I would say that from an era in the 80s where the performance status of the patient and the patient's fitness level was perhaps the only indicator which used to determine whether at all a patient with advanced lung cancer should be given treatment. We have reached an era of personalized medicine wherein even with poor performance status, if you are able to find some molecular targets, there is a lot that can be done for patients, and a lot of promise is what really holds for these patients in the future. And therefore, this has completely become a disease where you treat them like any other chronic illness.
Right. Thank you, Dr. Suhail. Getting back to Dr. Reddy, Dr. Reddy, I would like to repeat the
Yeah.
question for you.
Is it
What
audible now?
strategies? Yes, yes, you're audible, doctor.
Thank you. Yeah.
Yes, doctor. So I would want to know from you what strategies or initiatives do you think could boost the screening and early detection of lung cancer in India, considering that there is a diverse healthcare landscape when it comes to a country like India?
Yeah. So good evening, everyone. Great that Pfizer has created this opportunity to discuss about the lung cancer screening. So I think treating lung cancer after someone gets it is quite easy. So I think we are in a situation where probably we need to probably catch them early. That's where the screening helps. So as is the current evidence is available. So whom to screen is the biggest challenge, especially in a country like India, where probably most of them do not seek medical care unless they have symptoms. So for lung cancer, fortunately, all those heavy smokers, as we say, it's based on the pack years of cigarette they smoke. So if someone smokes a pack of cigarettes per year, and if it is amounting to 20 pack years or so, these are the patients who are classified as heavy smokers. So these patients do have the benefit of going for screening with a CT scan. Usually, I think for diagnostic CT, we do have
Dr. Reddy, we lost your video. Hello. There is some technical glitch at doctor's end. Welcome, Dr. Bhuvan. We have Dr. Bhuvan joined us, and we would like to move on to Dr. Amit. Dr. Amit, are there any specific challenges, perhaps gender related disparities, that lung cancer patients commonly encounter in India? And also, if you could just walk us through some of the measures that can be taken to address them.
Yeah, so good evening and thank you for having all of us for this very important show. See, there are a couple of challenges which I see is prevalent in India regarding lung cancer thing. So one, so we don't have access to good hospital, good cancer care hospital. They have to be state of art hospital with all the specialties available to us, like radiation oncology, surgical oncology, and medical oncology, all under one roof. So we usually miss that. Second, if you go to the rural part or say semi-urban part of the India, it becomes even worse. Diagnostic facilities like PET CT scan or even CT scan for that sake is not available for routine uses. Forget about molecular labs. So we don't have great molecular labs available to us. So you can't manage lung cancer these days if those labs are not available. So these are a couple of challenges. Plus, we are resource crunch country, so we don't have a lot of money for those newer treatments that we speak of, like immunotherapy or those targeted treatments which should be done. So the resource also becomes a problem in majority of the places across India. More so for females because they have more advanced disease. They usually don't report to healthcare as much as the males do. So these are a couple of challenges which I see. Only way which we can solve this problem is to spread more awareness so that they come to us earlier than later. Plus, there are lots of government and private partnership which can solve the problems of resource when this is not great.
Right, Doctor. Thank you, Dr. Amit. So, speaking of the challenges, Dr. Bhuvan, can you share some insights into any regional or socio-economic differences in the prevalence and treatment outcomes of lung cancer?
Can you just give me one second? I'm just logging in from the computer. It'll be
Sure,
easier
sure,
for
sure,
me
sure.
to. I think
Sure, please.
I'm already there. Sorry, can you hear me now?
Yes, I can hear you, Doctor.
So hi,
Yes.
sorry for the
No
wait.
problem. Do you want
I
me to
think
go over the question again?
I think you asked me social economical challenges in
That's
terms
right.
of lung cancer, what it is.
That's right.
See, the point is, I think you ask a very pertinent question. I come from a rural Haryana background, and I can certainly tell you that possibly a patient getting treatment in Rohtak will certainly have an entirely different spectrum and a entirely different, you know, exposure and approach to a disease as somebody who's probably based out in Delhi NCR or possibly, let's say, in any other metro city. So, yes, there are certain challenges. There are obviously the challenges start at a very educational level in terms of the learning about the disease, the exposure to the educational material, the lung screening part to it. When do you screen and when do you not screen? You probably it's I when we started a lung screening program in Max Gurgaon as a test trial, we had a lot of young patients coming in who were young smokers who had those lung nodules. But if you tell somebody sitting in Gaon who smokes hookah to go for a lung screening CT, he'll probably laugh you off. So what I'm saying is essentially the educational challenges and the acceptability to the newer modern techniques is quite a lot different. That's where as well the screening is concerned. So but then you have to educate, you have to understand the problem, and you have to start educating them that this is a reality. You'll probably have to do it. And that is the reason, if you look at it, there's a lot of there are higher number of cases in and around Gurgaon coming from rural Haryana because of the hookah smoking habits which already are there. So that's the reason there's a clustering of cases there. As far as the treatment is concerned, obviously, it goes without saying that person sitting in Delhi NCR or a metro city will certainly have a higher exposure to the number of drugs which are available, to the newer thoracoscopic surgeries, VATS associated process. I think that's the very secondary thing to be done, and that's not what is possibly of interest to our target audience. I think what we need to understand is at a very educational level, it has to be there are differences. We need to accept those differences, and we need to start forming our policies knowing those differences in mind and accepting the challenges which we have.
Right. Thank you for the insights, Dr. Chu. Dr. Reddy, my next question is to you.
Yeah.
In the digital age of digital communication, how do you envision the role of social media in building awareness about lung cancer, supporting the patients, and fostering advocacy efforts?
Yeah, I think social media, as all of us know, that it's one of the most used media nowadays. I think everyone has a smartphone, and I think we need to spread awareness through the social media about the lung cancer. And I think who spreads it is more important. So I think we do have these influencers or so-called social media celebrities who should be probably creating more awareness. And probably, unfortunate thing is most of them do promote smoking themselves. So we need to have these good influencers who should be away from these tobacco products. And I think all of us know that for lung cancer, the only known cause which is preventable is smoking. So if you are staying away from smoking, I think that's more than half job done in preventing lung cancer in our country.
Right. So, Dr. Suhail, would you like to add something to this in terms of, we spoke of the influencers. Now we would want to understand how can the medical community, take proactive steps in advocating for lung cancer awareness and patient care.
So, thank you. I think Dr. Reddy raised a very pertinent point about celebrities using their stature differently and more responsibly, so that the most important risk factor, which is smoking, in the causation of lung cancer, is taken care of. And I think that one single measure would actually amount to a great help for all of us in managing the threat of lung cancer by and large. But if you speak about the role of the medical community at large, I was just thinking about it. So, three or four important points just come to my mind offhand. And most importantly, we all need to understand that now lung cancer is managed with a participatory medicine approach, not an approach of exclusion or exclusionary approach, wherein gone are the days when just your physician or your oncologist was enough to take decisions for you, or your family physician was enough to take decisions for you. Now, any patient of lung cancer has to be cared for by a team of specialists, which include a medical oncologist, a radiation oncologist, the pathologist. The role of the pathologist is extremely important. So also the role of a molecular oncologist, and eventually the role of a palliative care physician in situations where you're dealing with stage 4 and best supportive care services. Other than that, I think it's very important to remove the stigma which is associated with lung cancer. As Bhuvan very rightly pointed out, that if you go to the rural hinterland, people are likely to, brush it under the carpet. And many of the times there is a societal bias that people tend to think that, oh, you got it on to yourself if you were smoking. And if you have lung cancer, then you necessarily must have smoked. That is not the case. A large majority of lung cancers that we see today are also happening amongst non-smokers and never smokers. And these are the cases which we need to be very, very careful about treating, because many of them harbor genetic mutations and molecular targets which make the treatment very easy. Moreover, the role of the medical community in raising funding for research is also very important. Now, what happens is lung cancer is kind of an getting the funding from government agencies, primarily because the 5-year survival rates in lung cancer are very dismal, very unlike breast cancer or prostate cancer, wherein you have, where the survivors actually live on to tell their stories and tell their tales, and it's easy for those category of to get good funding. In lung cancer, it is up to the family members of the patients or the doctors to actually, make a difference and, work for funding. Fourth point is about genomic profiling, which is also very important, because in the era of personalized medicine, which has transformed the management of lung cancer care, targeted therapy and its availability also, brings up a lot of challenges. So not only is targeted therapy very costly at times, even the genomic profiling is not something that is easily available at most centers, or if it is available, then the patients cannot afford it. So the medical community, by and large, has to work towards finding cheaper ways of devising situations where people can afford genomic profiling, go in for NGS testing or liquid biopsy-based tests, so that we have a larger number of patients who can be potentially candidates for targeted therapy. And finally, the end life issues is something for which doctors need to be involved with the palliative care physician, with the patient's family members, to understand what is their expectation of the disease, so that you're all on the same side of the line when it comes to managing the patients in those difficult journey of the whole spectrum.
Right. Dr. Bhuvan, how can patient advocates actively contribute to raising awareness? Since we already spoke about digital communication, we spoke about the medical community. I would also want to understand how the patient advocates can contribute to this.
So I presume when you talk about patient advocates, we're talking about support groups and the role of support groups there. So what I sincerely think that whenever no you get exposed to the patient advocates the moment you have a disease. Before that, you generally don't interact with them, or even if you interact with them, that's a very limited off the topic conversation. So uh, how do you engage? I'm thinking very practical perspective that how do I tell my support group people to go and cause awareness is. So generally, whenever we have, let's say for example, we take the breast cancer, and the in the breast cancer awareness months, you do a lot of support group activities in which you generate a lot general population know-how of breast cancer, and then you talk about breast cancer a lot, and you talk about screening mammograms a lot. I think it's easier for breast cancer because generally the survival in breast cancer is longer. So you have a lot more support. And it's a very, I'm talking about from a very practical problem that, you have a higher number of breast cancer survivors or patient advocates as compared to you would probably have it for lung cancer. And I myself faced it. So there was a CNN guy who was approaching me for patient advocates for lung cancer. And when I screened through for my support groups, I could hardly find lung cancer advocates. And so I can, but how do you engage them? Once you have a group of them, you positively motivate them to do these support group activities in which you obviously raise awareness of lung cancer. Possibly a CT screening will help you. If you have a patient story in which you can, it's a successful story in which one of the patients had kind of found it early, that becomes one of the trending topics or one of the trending stories in which a life was saved because somebody did a CT screening. So I think those case points would have to be done. That's one way. And I think other than that, obviously, the primary prevention can also come in, as in how how not smoking will probably help you there, and that's where somebody who has undergone the entire disease and the treatment, and when he or she is speaking from a very horse's mouth, it'll have a lot more impact than possibly a family member telling them not to smoke. So I think those are the few things which possibly a patient advocate will be able to certainly help.
Thank you. Thank you, Dr. Chugh. Moving to Dr. Amit, are there any ongoing research initiatives or any innovative approaches that you would want to talk about that promise in advancing the treatment of lung cancer?
See, this is a very good question, but actually, there is no good answer from my side. See, we are not a country where, there is a great innovation happening, day in and day out. We borrow all the research and the research outcome from Western country like USA and Europe. We could not have, till date contributed anything, regarding screening program or, for the drugs which, helps patient quit smoking. We could not tell conclusively how to stage disease. We could never, tell the world that how to stage the disease properly. Forget about the diagnostic molecular testing. All are, the creation of world. All these new drugs that we talk day in and day out in lung cancer management, be it chemotherapy, then targeted treatment or immunotherapy, all has been lended to us. Nothing is a creation of India. It's a very sorry figure, or it's a very shameful thing for all of us. There are great institutions in India like TMH, AIMS, Dwary, and whatnot, but then we focus the quality of research that India is doing is not great. Somebody must look into it. I'm not there at those tertiary care center anymore, but I truly believe India could have contributed a lot we need not to find a new drugs, but at least things which were not very resource demanding research. At least those should have been done, and we could have led our country somewhere into the lung cancer map. So whenever we travel to conferences, we are dying to see an Indian brother or sisters, speaking something on it. But then, having said that, there are minor researches, not of great clinical importance, I will say, happening in those tertiary care centers like AIMS, PMH, Kidwai, Adyar, and even private sector is coming up. So there are some collaboration, which is happening now between different private hospitals. People do come together, but then majority of our researches are, multicentric researches, which are usually led by a principal investigator sitting somewhere abroad rather than sitting here in India. So good question, but answer is poor. We want a lot of things happening from India, but unfortunately nothing as of now to speak proudly about.
Yes, doctor. Moving to my next question, which is open to all. How can collaboration between public and private healthcare sectors be strengthened to ensure more comprehensive and accessible lung cancer care?
Yeah, so let me check since nobody is taking up this question. So see, there are a couple of measures, which we all can do from our side, from clinicians' behalf. Our role is to tell them that, as Dr. Suhail rightly pointed out, this is a big problem. This is, epidemic that we are already seeing because we copied their lifestyle. We are smoking more, and this is creating ruckus. More and more number of males were, they were already there. Now smoking has, picked up in females too. And, as he rightly pointed out, vehicular pollution, secondhand smoke, so we should go to corporate world, tell them that this is a big problem. You guys, like social influencers should also put it, at various forums. And I do understand more and more companies should take up this as their corporate social responsibility to contribute something for lung cancer. Though this is a deadly disease, kills more, like breast and colon, as some of my, panelists highlighted it. But then this is also a disease which deserves a chance, be it in research or be it in treatment or be it help in terms of those who are already existing patients. If they can do it, I think the lung cancer scenario will be a bit better in our country.
Right.
So,
Dr. Suhail, would you
just
like
to
to add?
carry forward that point which Dr. Amit has very categorically made, and I agree with him. I, to my mind, I think there is a huge disparity between the public and private sector when it comes to the number of patients, which are far greater in the public sector hospitals for obvious reasons, and towards better facilities which are there in the tertiary care corporate hospitals in the private sector. So we need to find a middle path wherein, as Dr. Amit also said, wherein we can actually hold hands, make a public-private partnership model to actually give impetus to research, to actually give impetus to newer modalities of treatment, maybe trials, and stop relying on the guidelines which are always, kind of extrapolated on us from the Western population data. We are a country of more than a billion patients. We can actually formulate our own guidelines if there was a will and if there was, concerted efforts made in that direction. However, in India, what we actually see is that we don't ask the right questions to our policymakers, and therefore research for, let alone lung cancer, the funding for any kind of cancer is something which is really found wanting. So I think it's important to educate not just the medical community, but as well as the general public to ask the right questions to the policymakers so that there can be concerted efforts made in this regard. And there can actually be models wherein the government sector and the private sector can collaborate to, formulate guidelines, make trials, make our own data available to the world and show them that this can be done in India as well.
Right. Dr. Reddy, would you like to add something to this?
Yeah, I think most important thing what I practice in a private setup. So I think the patient's IC is different. So there is definitely a chance for collaboration, but how do we do it is the most important challenge which most of us face. So they both of them have their pros and cons. So I think in our state, I think we do have a registry where we see like what's happening with our patients and who are registered and what are the numbers which are going which way. So I think with this registry, we are at least able to know like what's the incidence and what's the prognosis and where which stage we are seeing these cancers patients. And coming to the collaboration for research and treatment, I think that was already highlighted. I think there's some patient education also which needs to be done, mainly because most of us are damn afraid to do any trials compared to the West, mainly for the litigation thing, which people say is more in West, but actually it's very bad in India. So we also need good patients who are willing to go through research, which probably benefits them. They need to learn from the West actually, because I think in the West, most of the treatments are on the clinical trial basis than the standard of care, which is right away available in the hospital. So I think the patients also need to be educated more about the trials than creating any. They feel like whatever bad happens, it's created by the hospital or doctor. So that mentality has to change in the patient's mindset, that the research is for a broader thing for the generation. I think any of us can be affected with cancer, and I think if this research goes through and they are contributing in whatsoever way, I think we may be able to be on the global stage where we'll be discovering new drugs and probably we might be doing better with our population resources.
Thank you, Dr. Reddy. We would also love to know Dr. Chugh's view on the topic.
Talking about public-private partnership, I think I think a lot has been said already. I have possibly worked in the private sector for the longest time, other than the senior residency time, which I was in the. So I think a lot has already been said, but the studies which I find is I think we were having a discussion the other day that the way we are designing our studies, how we can have a lot more collaborative studies in India, in which the multicentric studies can be done, and those multicentric studies, how they can kind of help us define our policies better. So I think, uh, for example, I don't know if you looked at this year, there was this there was a study called a Zenair study in ESMO 2023, which had kind of said the effect of pollution on the breast cancer risk in both the workplace as well as the domestic place. So, just a second. So, if such a study has to happen, I don't think it can happen without a public-private partnership. And when you design a study such as that, in which, let's say, you have to estimate the risk of lung cancer in Indian population, or Indian with the pollution levels which we have. So when you design that study, it has to be a very public-private practice, partnership study, and possibly that's where a role of a ICMR with a regular hospital will come in, and then you'll probably be able to define the pollution levels at workplace, the pollution levels at the residential place, and then you come up with a figure, and then you can possibly intervene better. So I think for me, the public-private partnership has to happen at a very research level, and I think from the research only we'll probably end up making a lot more policies, which will probably bring about a change. And this is how I see the partnership going forward.
Thank you. Thank
And
you for your
it's not as if that this is not entirely possible, and there have been instances in the past, not necessarily in healthcare, but just a couple of years back, ISRO managed to launch 104 satellites from different countries and put them into orbit. And not only did ISRO make a big name for itself, but it was also a profitable venture for them. Recently, ISRO and NASA have gotten into a partnership in space exploration after the successful launch of Chandrayaan. So it's basically just the intent which is lacking. We don't somehow take healthcare very seriously in this country. We saw that during COVID, although you could say that most of the well-developed countries are also suffering during COVID. But I don't think that we as a country have really learned our lessons and invested in healthcare even after that huge fiasco that we have seen. So our priorities are somehow misplaced, and I feel that healthcare hasn't really got its due with successive establishments, and therefore this is more a problem relating to intent than anything else.
Right, Dr. Qureshi. Um, Again, my last question to all of you is that I would want to understand briefly some of the educational strategies that you would recommend to increase public awareness about the signs and symptoms of lung cancer and also early reporting and diagnosis. Dr. Reddy, would you like to go
Yeah.
answer this question? Yeah.
Educational strategies, I think most of the times, as all of us know, that the social media is one of the first thing. I think gone are the days where people are reading the newspapers. I think you might be aware of the stats of like what is the current newspaper penetration. So I think that's the first thing. I think media, social media, and I think probably even the television are one of the main sources. And how to highlight them? I think probably we should have regular awareness programs and about what are the usual causative factors, how to prevent them, and probably even the signs and symptoms. And the common signs and symptoms for lung cancer, most of times it's overlapping with the common symptoms which we see, the cough, but not all patients with cough do have lung cancer. So those patients who have persistent cough, occasionally those who have blood in the sputum, chest pain, breathlessness, not resolving even after a couple of weeks of intervention by the doctor should raise a red flag. And symptoms, these are usually the common symptoms which usually we see. And signs, most of the times the doctor sees this and identifies. So if we have any of the symptoms which are persistent for 2 weeks or more, they have to report to the doctor and let him assess and see whether it's something of concern or not. And other than the social media, other place to educate is probably it starts. I think what is depicted on the cigarette. The picture they have is actually of a oral cancer. So I think we need to have probably some education on the cigarette packet. I think at least of the common symptoms, we can have a pictorial depiction on that. Probably that can add in the future because the current advertising, the ban, I think it's only to put a statutory warning that it causes cancer, but no one reads it. So probably something the best media again is putting something on the cigarette pack and advertising about the harms of smoking.
Right. So, the harms of smoking. Would you like to add something to this, Dr. Amit?
Yeah, so I think the awareness should start from school because you see who gets lung cancer. Those who all smoke. Usually the smokers are 80% or more than lung cancer happens in the smoker, and the smoking they pick it up really early. These days probably from the school or as soon as they are done from the school. So if you don't start early, you never see a person smoking suddenly from the age of 35 or 40 years, of age. That's very very uncommon, and never happens that way. So if you want to strike early, go to the school, go to the parents group, go to those social group who have access to children, where they can talk to them and, educate them about harms of smoking. Probably education, mere education or mere telling does not, probably get registered in these days kids' brain because they will listen to you but still act on their own. So, probably a group visit of school, like they take our, kids to say science museum, to zoo. They should probably bring one day their kids to hospitals, to oncology wards. They should see bad kinds of oral cancer. What happens when they get lung cancer. They are pathetic. And probably if you let them see, I some people may say this might be traumatic for the kid, but I would say probably this will have a lasting impression on their brain that they must not do, because once they see the harm, probably they will refrain away. But apart from what I said, Dr. Reddy also rightly pointed out, social media has a big role to play. My sixth standard kid is mostly with social media. So as well as he's going to school, he's on social media too. So there should be a constant bombardment to their brain and head. And the real challenge will be you can put the information there. How to make that information really really interesting, that my 6 year or somebody 7 years starts seeing and educating them and learning from them will be a real challenge. The content has to be interesting and good, and in a way presented that it will strike to their brain and heart.
Definitely, Doctor. So I would want to get the concluding remarks from all of you about the topic. So, Dr. Qureshi, would you like to go first?
So yes, I wholeheartedly agree with the uh, panelists before me, Dr. Reddy and Dr. Amit have actually just hit the nail on its head, and it just reminded me a few months back I was in a school to deliver a talk on cancer awareness, and I had students of class 10th, 11th, and 12th in the auditorium along with the teachers. And during the question answer session, class 11th student stood up and he asked me that with a sheepish grin on his face that I want to ask for my friend, do e-cigarettes also raise the risk for lung cancer? Because many of the times, my friend says that I'm not smoking an actual cigarette, I'm actually using an e-vapor. So I was actually stumped, and I could actually make out that maybe he's just, asking that question for himself, but just saying that it was his friend because there are teachers around him. And it was actually something which I had never really thought, given it a thought, because these are newer challenges. We've all seen people smoking hookah, bidi, cigarette, pan masala, and so on. But e-vaping is now something which is very prevalent among the school-going kids. That's how they start. They graduate to the flavored hookahs, which they get in their parties and social setups and bars and so on, and that's how they start picking up that cancer stick. So it's very, very important to remain abreast of technology, to remain abreast of the changes that are taking place around us. And yes, our kids in class 6th or 7th will become a mirror for us to know what's going on in that age group, and that is the age group that we need to target so that we can actually nip this problem in the bud before it becomes a public health issue. Thank you.
Thank you, Doctor. Dr. Chugh, your closing remarks on the topic.
I think along with that, I'd just like to answer the question which is there in the chat box, I guess. What is the percentage of
Okay.
lung cancers diagnosed because of pollution, which is rampant these days? So I think just to answer that question, what is important to us is the particulate matter. The particulate matter is what goes into your lungs. So the particulate matter is defined by the diameter size of it. So it's the 10 microns. That's the PM10. More than the 10 micron particulate matter is kind of doesn't enter your lungs. It's the less than 10 particulate matter which enters your lung. What is more harmful is the PM 2.5, which kind of goes up to the end points and gets settles in your alveoli. So for every, as per the WHO, the fine air is which has a PM of less than the PM10 of I think less than 10 or 20. The Indian average is somewhere around 80, 90, despite despite the Indian average is somewhere around 80, 90, despite the winter season or the summer season. And for every 10 or 15 rise in PM10, it kind of increases the risk of lung cancer by 8 to 9%. So now if you're staying at a PM10 of 400 something, I don't want to even imagine what is the lung cancer risk which we are dealing with. I think it's pretty scary there. So, my concluding remarks, I think lung cancer is a reality. As Dr. Suhail rightly mentioned, so the moment there was this Netflix documentary which came out on vaping, and I think me and my wife, we were literally keenly watching that Netflix documentary to understand the vaping. And I think today morning I was reading a New York Times article about how the vaping has changed. It has changed from
Share that link in the chat box, Bhuvan, for everybody.
So it has the how the vaping has changed in the recent time is, so there was this entire year of Joule which was there, and then the Joule has moved on to this newer vapes which are there. I think it's a New York Times article which is also there. So if you guys remember clearly, between 2015 and 2016 there was this spate of New England Journal of Art, New England Journal of Medicine articles about vaping associated lung injury. So I think that was the time when the vaping was picking up high and Juul was getting a lot of famous. And I think that's the time when Marlboro, the parent company, had bought in the Juul, and I think there were a lot of parent advocacy groups against the e-vaping. So and now what has moved on is the vaping devices have moved on. There is new devices which have come. So just to, because Suhail spoke about it, so I remembered that New York Times article also. It's there in the morning, today morning New York Times. Anyway, so to concluding remarks, it's a reality. Smoking is one of the most easily modifiable risk factors. Catch early, teach them young. How to make it more attractive is the challenge. So I certainly feel that the way we have gotten about breast cancer, the way we have made breast cancer screening and detection and talking about it a little more attractive and catchy. We need to do the same thing with lung cancer. The second is the other modifiable risk factors, pollution. You need to obviously speak to the, you need to change your policies in which the pollution comes down. The government policies have to be like that. So I think it's essentially the same, and that's what my concluding remark is.
Thank you, Doctor. Dr. Reddy, Dr. Amit, we would also want to know your concluding remarks on the topic, please.
Yeah, I think simple thing is first, as I think most of the panel did say, uh, creating awareness and prevention is the best thing, and avoiding smoking and avoiding the celebrity status associated with smoking should be stopped. And probably one area of the best advertising, the cheapest, is probably the cigarette pack, where I think more information needs to be packed on the cigarette pack. And how do we do that? I think it's for the bureaucrats to do that, and I think the government has to do with this to forget, and they need to probably decrease their revenue on that. Though the taxing is one thing which the government is trying to do by increasing the taxes, they want to decrease it, but I think it's taking the other way hit on the finances of those who are addicted. And vaping, I think it's almost illegal, I think, in most of our states. And I think the other thing which is catching up is probably the hookah. And what we need to tell our patients, and probably the younger ones who are starting them at an early age, is to educate them about the bad things which happen, and probably uh, smoking and preventing them is very much important, because treating, again, it's altogether a different aspect. Once we get cancer, that's a different ball game. So quit smoking and spread awareness about avoiding all products of tobacco to probably reduce the risk of lung cancer.
Right, Doctor. Thank you so much. Dr. Amit, you were saying something. Please go ahead.
Yeah, so I was saying that, however best you try, we also tried tonight, probably many other doctors, and other people will try also in this. It's almost impossible. You will teach them, but people will keep smoking, they will keep getting lung cancer. So so you can work on that. It's a constant work in progress that, we should do as a team at various level, various forums, various places, at different time places. But then whatever is already there, you should also not forget to tackle them. So have best of the world class hospitals at not only in the tier one city, but go back to tier two, tier three. At least open a decent hospital which knows how to treat lung cancer. Give them radiation machine so that wherever the radiation is needed, they can do that. Do that. Have good number of medical oncologists, those who can do good chemotherapy or targeted treatment or immunotherapy. Have the at least decent surgeon who can operate lung cancer fairly at other places. These two are very, very important. Then, coming to the drug pricing, see, we were never a great researcher, as I earlier told to, you all in answer to one of the questions. So we must focus on the generics, and we should, we are world class at that, copying. So we are very good at copying those, innovative products, and if we can copy it well, and if the government can allow it for our poor people, you can't do for every product, because there is something called patent, and patent laws are there internationally, so that we have to respect. But then we must find a way, to bring those molecules early in at a cheaper price, or from countries where they are getting already at a cheaper price, import them and use it for our patients. Those are also very, very important idea. I totally agree with what Suhail made a very great point, that we must have a healthy debate in parliament. This is a very high time. We debate on a lot of things, at parliament, but then I hardly see a good health debate happening. And I have, more so, I have hardly heard a good debate on lung cancer cases. So we can talk of your times, we can talk of any gem, we can talk of anything, but then, if we don't have it in our parliament, I think it's not going to percolate to the society. and we all should be very, very aware citizen, and we also vote rightly on the basis of now health, and that will probably change the dynamics of not only lung cancer but other types of cancer too. Thank you.
Thank you, Doctor. Thank you, everyone, for being a part of tonight's talk on tackling lung cancer challenges in India. Big thanks to our expert panel for the insights. We've explored important aspects from challenges to advocacy. Let's carry this knowledge forward, spreading awareness and supporting each other. A special shout out to Pfizer for making this happen. Keep the conversation going. Let's empower against lung cancer together. Thank you so much.
Thank you.
Thank you and good night.
Thank you.
Thank
Thank you. Good night.